All right, we continue to monitor developments in the Northwest for you tonight. The ugly face of the collapsed Northwest public health sector became evident today. The body of a deceased patient at the Mahikeng Provincial Hospital was left unattended for several hours. There was no one on duty to take it to a mortuary. The Health MEC, who is a qualified medical doctor, tended to patients while awaiting the deployment of SANDF members at the hospital. Well, problems in the health sector largely triggered the violent protest action that erupted in the Northwest this week.
The shocking face of neglect. This patient in the chronic ward dead for several hours, her drip not even removed. Other patients in the ward say she passed away last night. The wave of protest action in the province can be traced back to problems in the health sector, corruption allegations related to the department, and disgruntlement over the leadership of Premier Supra Mahumapelo. The Education, Health and Allied Workers Union, NEHAWU, embarked on strike action in February. As many as 400 clinics have been closed.
Only nearest clinic in our community, so we can't go to the other clinics because they are far.
Unable to access chronic medication and treatment, many flocked to Mahikeng Provincial Hospital, already burdened by increased referrals.
Pelong Hospital, Taung Hospital, Joe Morolong, JST, Tusong, Klekstop Hospital, you name them. Potchefstroom Hospital, which is already in crisis. It will mean that we must close those facilities.
This earlier threat by NEHAWU materialized on Wednesday. The majority of nurses downed tools.
I don't receive food, medication, nothing.
Many patients simply discharged themselves. Angered by the lack of health services, Motshiwa residents embarked on violent protest action on Wednesday. The protests spread throughout Mahikeng and surrounding villages. The situation so critical, the MEC for Health tended to patients. Health workers deserted their posts.
We had reached a stage where there will be mediation by an outside party from the CCMA. However, there is now a new task team led by MEC Lehare to take that process forward.
The Premier finally suspended Provincial Health HOD Dr. Tabule Kalakala on Thursday. The Gupta-linked Mediosa company, which paid for Lekalakala's trip to India, received a 30 million rand advance before rendering services. Nicolene Smallman, SABC News, Mahikeng.